That clock, and my watch is close enough. So first of all, thank you everybody for coming out. For those of you who do not know who I am Rob Boyer, the risk manager. We are here to talk about our new, and in my opinion, exciting option for the healthcare plan. It's very different than what you're used to, which is why we're doing this, so that you can understand what it is and decide if it's right for you or your families. And I won't even try to describe it because I can do it pretty poorly. So that's why we brought in the experts, and I will let them do their presentation. And feel free to ask questions. This is kind of going to be your time to learn. So with that, here you go. Don't clap.
Do you want to do introductions real quick? Okay, so my name is Julie Calvert. I work with Gallagher Benefit Services. We are the broker for Lake County Schools. We work closely with you on your entire benefits package. So we work with all of the carriers, and we worked with HPI to bring this solution to you as employees for your benefits package. So I will let Elizabeth and the HPI team introduce themselves.
Hi, everybody. Thank you so much for coming out. My name is Elizabeth Fire. I'm the VP of National Sales over at HPI, also known as Health Plans, Inc. We are the third-party administrator, and here in just a second, once we're done with introductions, I'll let you know what that actually means and how to kind of apply that to what you have today with Blue Cross.
Hello, my name is Kathy Smutzer, and I am a account executive with HPI, and I'm just here to help out Elizabeth when, she needs an answer. No, I'm kidding.
I'm Kim Klein. I come with the concierge service, so this Premier plan has a really exciting component where there is a front-end concierge team that's going to help navigate the plan and answer your questions and connect with some clinical resources, and they all report up through me, so we're excited to work with you.
Thanks, ladies. So I have to say, I know we've gotten so far, we were here earlier from like 10 to 1. The majority of the questions have been around provider lookup, right? So I would just ask, allow us, if you can, the opportunity to come in and explain who we are and what it is that we're offering to you, and then we'll get into the questions regarding providers, how to look those up, and what to expect this summer, okay? So a little bit about HPI, again, also known as Health Plans, Inc. We're based in Boston. We've been around now for 42 years, and we're owned by a not-for-profit organization called Harvard Pilgrim Healthcare. How this kind of applies to you is that today, with Blue Cross and Blue Shield, you have Blue Cross as your administrator, so they pay the claims, they process, they also do customer service, and then they're also your network as well, right? So you get everything in one bundled package. The challenge with that, though, is that sometimes you have services that are costing a little too much for whether it's the plan or you as the member. There's not really an accountability or transparency to where services are being rendered or the charges for that. There's also not the accountability for basically proper customer service, I like to call it, right? So as Kim just mentioned, we're offering you a concierge type of plan, so a dedicated customer service team, which we'll get into in just a second. So I love the fact that HPI, we are your administrators, so you'll see our name on the front of the insurance card, but what we're offering to you is what we call Employers Health Network, or EHN. That's the actual PPO network that we're offering to you. So while you have Blue Cross as your administrator again, your network, and your customer service team, you'll have HPI as your administrator, and we basically quarterback EHN and then the concierge customer service team that comes with this. When you look at the total cost of care and what's happening today in the healthcare market, there's a really great analogy that's kind of out there. And it is, if you and I take the same vacation, right, the same duration of time, we go to the same places to eat, the same entertainment, only at the end of the vacation, I pay with my Visa and you pay with your MasterCard. But at the end of that, once you get done paying, your vacation is $10,000 more than mine. You'd probably have an issue with that, right? You'd probably ask a lot of questions. You'd want an itemized bill or a statement. You'd want to talk to the manager because it didn't seem right that the only difference was that you paid with a different credit card. This is the same thing that happens in healthcare today. So it's not fair, but you could have services rendered with one insurance carrier or company, and the price could be one way where it is a different way with another insurance carrier. So what we're saying is we're coming in and offering you quality care, the best-in-class quality care, but at a reduced price. So the great thing about the network coverage that you have today is that you can really kind of go see any provider, right? But it doesn't necessarily mean quality care. What we're offering to you is saying you'll have a reduced network, but it's going to be at the best-in-class quality care, again, at a reduced price. So Employers Health Network is a clinically integrated high-performance network. They focus on the quality of care. So I don't know about you, but I know that I've definitely been a victim to this in the healthcare industry where something could go wrong. You may have a pain. You don't know the types of questions to ask. You may go see a PCP, and they may do lab work or blood work. They may do MRIs, imaging, scans, and whatnot. But then at the end of that, you may be just as lost after you do all of that work as you were whenever you first went in for that care. So this is really saying, let us provide you with a PCP. You may have one today, or we can help find you one within the Orlando health system, or even looking at a couple of the other, like UF Health is another health system that's in this as well. But let us help you navigate through the healthcare system to find the best in quality care without you having to roam around and trying to figure out the questions, whether it's on Google or internet search, or you having to go through an alternative way to do that. So we have our concierge team, which we'll talk about here in just a minute, but then you also have, again, this high performance network solution that's going to come in and offer you the best in class care. As I mentioned, some of the health systems that are included in this are UF Health, so you have Leesburg, and then also the Villages, as well as Orlando Health System too. So there's a variety of different health systems within the area that we're in, as well as you have urgent care facilities, PCPs, specialists. So you do have to think of this as very similar to what you have today with Blue Cross. It's just a smaller sized network, because it's quality providers. So it's providers that have to meet certain performance metrics in order to be included in this.
So we're going to talk about this a little bit more in detail in a couple of slides, but we did want to talk briefly about the provider network here. So as she mentioned, your primary network is going to be the Employers Health Network, or EHN, and we'll show you exactly where to access the information for that. But it does include Orlando Health and the UF Health Network that we have kind of already talked about. One thing we do want to make sure, we've talked about this a little bit already, I think it was before some of you got in here, but Advent Health is not included in the EHN network, so we want to make that clear up front. But we will tell you how to navigate that if that's the providers that you want to use. So we will go into a little more detail about that shortly. There's also a network called PHCS that will have some extended provider networks outside of Orlando Health and UF Health. What I will tell you is don't Google PHCS network, because there are multiple layers to that network, so we want to make sure you've got accurate data when you're searching that. And I know we all want all the answers right now, but what I will tell you, if you'll be patient with us, as we go through the summer, we're going to have more and more information coming out, and there will actually be an app for you guys to use that will be dedicated to your exact network that will help you navigate some of this. So it's not ready today, but it will be released. It'll be, I think, July.
The launch date is July 1st.
The launch date for that is July 1st. So we will have that information available to you. So I would caution you, don't go Google PHCS. We want to make sure you're having accurate information. But again, Advent Health is not, and as Kim mentioned, the Pathways Concierge team, that's where they're going to come in and help you navigate a lot of this, the network questions. So we're going to introduce you how to access them, so you'll have a single point of contact for having a lot of those questions answered.
Did you say UF Health was
Yes.
Yes, ma'am.
UF Health is part of the EHN network.
Orlando Health?
And Orlando Health Network, yes, ma'am. So this is the EHN network website. Again, a lot of this is going to be in the documentation that you guys receive ongoing throughout the summer for you to access. This just lets you know it's got, this EHN includes providers, so your PCP specialist and your facilities are all going to be included in this EHN network.
And you can, if you'd like, you can go to this website
Yes.
for EHN and look at who the providers and specialists are, the facilities that are indicated in that network link. As Julie mentioned, though, there is going to be an app, and that app is going to include the primary network, which is EHN, and then there's also going to be a physician and ancillary network that covers outside of EHN as well. So that app will include all of those providers in one place for you. So this summer, you'll start to see us come in with videos like Brain Shark videos or Avatar videos that talk about the product. We'll also direct you on how to look up providers, and then the concierge team will also be ready to go prior to September 1st, so prior to open enrollment, so you can ask your questions.
And I'm just because I see a lot of people trying to write that down in a hurry. It's at the bottom of this flyer as well. The link, that same link that's up there, and then what you need to put in for a group ID, it's the word all, A-L-L, and then this little QR code just pulls up facilities if you open up this. The link pulls up everything, facilities and providers, and the QR code just pulls up the facilities.
Thanks, Kathy.
Yep.
The flyers that we handed out are what we call a buyer persona. So these are going to give you some great examples as to if you're a great fit for the HPI Premier Plan. So if you currently are going to a provider that is in the EHN or PHCS network, or you do receive care or a service at one of the facilities within the EHN network, you're a great candidate for it. If by chance you happen to have a provider that is not in the EHN or PHCS network, and you do want to receive care at a facility that is not contracted by EHN, let's say Advent, this may not be the plan for you. So this is really where we want to have conversations with the Pathways Concierge team to see what we can do to try to help navigate you through the healthcare system and making the best choice.
So plan design, I know the announcement for this meeting had a little bit about the plan design in them. It did announce zero deductible, zero cost shared, zero co-insurance, zero cost for employee only. So this gives you a little better picture of what your full plan options are going to be for the coming year. And again, all of this will be coming out in more detail over the next couple of months, but we did want to kind of give you an upfront. So on the left-hand side of the screen, you'll see the current plan options through Florida Blue, so the 4 plan options that you have available to you today. On the right side are going to be your 4 plan options for open enrollment. So you'll have the HPI plan, which as advertised is a zero deductible plan, a $2,500 out-of-pocket max. It's very co-pay driven, so no co-insurance. Everything you do is going to have a co-pay. Your primary care is a $20 co-pay, specialist or a $40 co-pay. A couple of things I do want to mention. We've had these questions throughout the day today. Under the HPI plan, you do still have access to the clinics, so the carrier clinics, that has not changed. You'll still have full access to the clinics. And your prescriptions would still be through Express Scripts, just as they are today under the Florida Blue plan. So that won't change either. So those concerns have come up a couple of times today. I just wanted to make sure. I do want to point out there are a couple of changes on the Florida Blue plan. You'll notice that we're going from 4 to 3 options under Florida Blue, and then the current 3559 plan, the deductible is going to be $1,000 going forward. So again, this chart is going to be coming out. And one thing I do want to note, if you're taking notes on this screen, the amount, the money at the bottom, those are monthly costs. So when you're looking at those are monthly figures. If you're looking at that going, that is not what I pay per paycheck under the current side. And kind of as a second reminder to that, your deductions are taken out of 20 pay periods. So don't look at that and divide it by 2 because you get paid twice a month or anything like that. They're monthly figures, but it's 20 paychecks. So there's a whole calculation with how to get those, and we can kind of help you figure that out if you need to. But I just wanted to kind of give that disclaimer on the cost at the bottom there. So any questions about the plan design? I know it's kind of small on the screen there, but again, all of this will be coming out to you over the summer months, so you'll have it in a little more detail.
And then how your plan works, so I'll just give a brief summary of what this really looks like, what you can expect as a member. So as we've mentioned, as of July 1st, we're going to launch what we call our HST Connect app, Within that app, you're going to be able to find all the providers that are included within the EHN and PHCS network. They are going to be color-coded. So the EHN providers will be color-coded a gold, and it'll direct you straight to those providers initially. And then, of course, you'll have additional coverage, and that's going to be under the PHCS network. You don't have to know all of this. All you have to do is go directly to the app, and it'll have, again, all of these providers and facilities listed for you and identified. In addition to that, you're also, and let me just say, there's a QR code, but again, you'll see a little box out there. If you click on it today, it's not going to allow you to go to the app. So just make sure July 1st, we'll send out additional communication for that. Your Pathways Concierge team, I'll actually let Kim kind of talk about, because this is her team, and they are based here in Lake County, which is pretty cool. So Kim, I'll let you take it away.
Absolutely. So as she mentioned, we kind of want that to be the first stop. If you accept this plan, we're going to be the only phone number on your card telling you where to go to get help with questions on your plan. And we want not just problems, we want proactive questions. We want to help everywhere along the way. So I have a provider I've been seeing. What do I have to tell them about this new plan? We want to help through the transition of moving to a new plan as well. So they're going to be ready to take calls about, let me talk to your provider with you or for you. Let me help you schedule the appointments. Or tell me a little bit about if you're having a lot of treatment, let's see what I can do to be proactive about getting everything transferred for you. We also have a team of clinicians that can help with that sort of coordination of care. So I don't mean to oversimplify it, but really we want you to call the concierge team for anything that's related to your health plan. And we will sometimes air traffic control out to the right places, but for the most part, we'll be able to help you get where you need to go and understand your plan.
Can you talk a little bit about transition of care and what that looks like?
Yeah, so we're going to do some work kind of on the back end and get some data on what's happening with the plan before we go live. So we'll kind of have a sense of where the claims are happening and what we're going to need to do to help. But we also want to really encourage everybody to take advantage of that concierge team. Or, there may be instances where we reach out to you, but one of our nurses will say, tell me about the care you're having so that we can help make sure everything's transitioned. The other thing that my team would probably be involved in for you is if you have a lot of ongoing care and you have like an authorization process. The Pathways team can help with that. And so we're going to get everything transferred and kind of take care of any of the work that needs to happen by going through this concierge team prior to the effective date.
And then again, whenever you need care outside of the network solution that we're providing you, so EHN, again, also known as Employers Health Network, if you need care outside of that network, you need to call the Pathways Concierge team. So they're going to be your advocate, and they're going to help to educate both the provider as well as help to navigate you on that call before you seek care. So always take those phone calls back to the Pathways Concierge team. And then here's an example of what your insurance card would look like if you chose to opt into the HPI EHN Premier plan. So you'll notice that it does have obviously the Lake County Schools logo on it. You have your plan designs as far as employee cost share and what that looks like. You'll also notice that it has the EHN network as well as Orlando Health. This is for provider recognition. And then it also has PHCS as well. So those are the network solutions that we've talked about today. And then on both the front and the back of the ID card is exactly what Kim just mentioned, is that you're going to have the Pathways Concierge number located on that insurance card. Providers, if they have a question, will also be directed back to the Pathways team as well. This just allows for a better member experience, and that's really what the concierge team is all about.
Okay, so next steps. So this really has kind of been a quick overview of how the plans work, how to kind of determine if this is a good fit for you. So what's next? What do you need to do? So you can go to the EHN network, as we had projected earlier. I couldn't think of my words. Projected earlier. If you need that again, it is on the handout. If you don't have a handout, we'll make sure you get one before you leave, so you can have access to that. Again, the app will be available July 1st, and that's going to be one of your go-tos. Your first go-to can be the Pathways Concierge team, but if you want to look up on the app, you can look up your providers for that. And then open enrollment. Open enrollment is going to be late July, early August. Again, you will get plenty of information over the summer about your open enrollment dates. We are going to have teams on site during open enrollment from both HPI and EMB. You guys should be familiar with EMB, Explain My Benefits. They've helped with your open enrollment for the last few years. So EMB and HPI will be boots on the ground during open enrollment to help answer any questions and walk through that process. So look for those dates and locations coming over the next couple of months. Again, the Pathways Concierge team, we've talked about that. And then all of these plans will be effective September 1st. So we'll go through the process, again, end of July, early August for open enrollment for a September 1st effective date for all of your plans.
Yes.
Yes.
The concierge team, is it working like a case manager and referral, like a gatekeeper?
No, the concierge team is upfront customer service. They have access to claims, they have access to everything that's happening with your plan, but it's customer service.
Okay, so the concierge team doesn't, like, say, for example, my doctor wants an MRI, the concierge team is not going to say, no, you can't have that,
So-
you need to do this.
There is a clinical component to this type of plan, and so there is some authorization requirements, things like that. A lot of that, MRIs, things like that will happen behind the scenes. The objective is not to gatekeep your doctors. We put in a high-performance network like EHN because we believe in the quality of those providers. So that makes it even easier for us to do our job on the clinical side. The main reason you would hear from us from a clinical perspective would be advocacy. Got a lot of nurses that study within certain specialties that can help you with your conditions and things like that. I wouldn't say gatekeep at all.
Yes, ma'am.
So my question is, if I sign up for this HPMI and I'm at Eustis Elementary and I fall out and end up at Advent Health Hospital, what happens?
Yep. Do you want to take that? That's fast.
Yep, let's talk about emergencies. Emergencies, you need to go get treated wherever you can. And there are rules and laws and compliance and no surprise acts that protect us from all of these technical things that we talk about. So in an emergency, always get care. You will not be turned away, and there's protections against getting billed in an emergency. We're talking about elective care or care that you know is going to happen that we can plan for.
But is there a higher cost for out-of-network emergency care?
Right. So we mentioned briefly kind of reference-based pricing and how we pay our providers. Especially in an emergency, there are limitations on how much these facilities can bill. So we can take care of those balance bills. And when you ever, if you ever do have an emergency and you end up at an Advent facility, I would say still give us a call so we can keep an eye on it and help you through anything that would happen. Providers can't bill you in an emergency situation. So we've got a team of people who will call them and make sure they know they can't send you this bill, or we'll get it, negotiated, or we'll get it taken care of.
What's the average time frame for that?
For an NSA claim,
Well, let's say I get a balance bill. What's the average time frame from receiving a balance bill till having it resolved with the zero bill back from the hospital?
yeah, varies by hospital. Just full disclosure, it could be quick, could be 3-4 months. We see it vary. But what we do, anytime you do end up with a balance bill, the very first thing we do is we ask you to sign a fair credit letter. And we provide that back to the reporting agencies in the facility. So it's going to protect your credit. And we get the hospital to put the bill on hold while we're going through the negotiations, if it is a negotiation. A lot of times it's just an education. But we're going to keep you updated the whole way through that process. We talked about the HST Connect app. Anytime there's a balance bill, you're going to get updates on that bill through that app as well, or the concierge team will know. So I can't give you a solid date on how long balance bills take, and they don't happen often, especially if you avoid Advent except for emergencies, but we will keep you updated the whole time.
And I want to make sure that we touch on this too. So today with your insurance carrier, you could get balance billed. You could easily go see a provider or seek care that's outside of the Blue Cross network, right? The only difference here that we're saying is that we have an entire team that's here to help educate and advocate for you. So you do have help, whereas today, you may not have that help. You may have to contact the facility or the provider directly to negotiate on your own behalf.
How much is the payment for emergency room?
It's 350.
350
$350
for an ER.
As the same, but for outpatient procedures.
What?
Sorry, I was trying to, but it's not allowing me to do it.
I believe outpatient
There
surgery
we go.
is 500.
I think so.
Yep.
I can see it better on here. Yeah, outpatient's 500.
And what's Surgery Plus though? Surgery Plus though?
Oh, Surgery Plus?
Oh, yeah, we do have the Surgery Plus, and Surgery Plus will work with HPI, just like it will work with the Florida Blue plans.
Yep. Yes, ma'am.
With Express Scripts, the way you do it, can I still go through Publix? Because I've been going through Publix
Your
through.
Express Scripts won't change. Yeah, the pharmacy benefit manager, the PBM is still going to be Express Scripts, and there's no change to how it's going to work with HPI the same exact way it works under Florida Blue.
Because I have a number of prescriptions in it.
You won't have to change that.
Juggling
Yep.
in this one. So this sounds a lot like an HMO. Am I wrong?
You're not wrong, but I would say it's more like, instead of having an open, like a very large national network, you have more of a condensed, high-quality performing network.
What if I'm, say, in New York
Mhm.
and something happens and I
Yes.
need a prescription or whatever, is it still covered?
That's correct, yep. And then let's say you were in New York and you had to seek care, right? This would fall, so EHN is only in certain markets, right? Because it is a smaller network. But that's where like the PHCS, the Physician Ancillary Network that we talked about, it has more provider coverage outside of EHN. That's where that would take place, as well as seeking care, and that's where the concierge team would take place so we could get you to the correct facility.
It goes all the way back to the West Coast.
That's correct.
Family.
Yep.
So you can take more vacations because we know you'll have providers on that.
No, my wife is waiting.
Is there literally like a map, you know, like with Verizon or stuff that shows me where there's not coverage under this? Or where you don't have, like where one of these plans doesn't have coverage?
So you're always going to have coverage. So it just may not, it may mean that EHN is not in a given area, but you're still always going to have the physician and ancillary network of PHCS, and you're still always going to be able to seek care at a given hospital, right? This is where,
For emergency care, yeah.
so, well, but even outside of that, let's say you move to Minnesota for some reason, right? Like,
For the summer.
yeah, for the summer, that's right.
I was
yeah.
trying to think, why would they move to Minnesota?
I know. Well, it came up earlier, so. But you'll always be able to seek care at that hospital. So again, nope, that's okay.
Within like the co-pays and things like
That's correct.
So
Yes.
I'm going to call my concierge.
That's right.
first.
Yep, yes.
And
Yep.
the app will show you nationally too. The app is not restricted to where you live. That app's going to show you everything. So if you want to Google your mom's house in California, before you sign up for the plan, you'll be able to do that as well. Was it California? Yeah.
You have to have surgical procedures somewhere else because the specialist who does that surgery is educated for it.
I mean, it would operate the same, right? So the same as like the exact same example, right? So you would end up calling the Pathways Concierge team. They would then help you with that care as far as setting that up, making sure the provider is well educated as to how they're going to be reimbursed.
Are we able to get any kind of travel insurance? Like my family's all in Canada, so what if I'm in Canada and I get sick? Would I call the concierge service and you would be able to help me, or can I
And
purchase it ahead of time?
I'm gonna, because usually plans do not cover out-of-country care, so that's not going to change. The only thing that usually, if it's an emergency, so let's say you're in Canada and you have a skiing accident, that can be submitted and reimbursed. You'd have to pay for it up front because it's, again, outside of the country and they usually require payment. But then you could submit those receipts and be reimbursed. If you're in Canada and you go in for earache, that's not going to be covered.
But yes, the concierge could help with that.
Yeah.
Yes.
I have another unique situation. So under Blue Cross Blue Shield, once the governor signs a bill, I'm losing certain aspects of my health care that I am currently covered under. This plan's not going to change that, is it? So I'll still lose that health care coverage.
Well, if, oh, go ahead.
No, I was just going to say, if it's a state, well, I don't know, you might have a better.
Well,
If
the
it,
reason why is because we work for a school county government.
Mm-hmm.
So if I didn't work for the school board or if I worked for a private school, I could still have that coverage. But because I work for a public entity, it's illegal for the public entity to provide me that health care coverage.
okay, so I
Is
don't.
that a Josh question? Maybe that's.
Possibly, but I don't think the care, we're probably gonna have to research that, but my gut is that a carrier is not gonna make a difference.
Well, I was already told that, because I did reach out to our benefits here with Blue Cross Blue Shield, and I will lose it immediately as soon as the governor signs the bill.
Okay,
So I was just wondering if this would save me that, and we're talking about gender affirming care.
let us do a little research on that, because I'm not 100% sure on that answer, but let us research that.
Any other questions? Yes.
So I've heard that for those of us who are in Region 1, if we stay with Blue Cross Blue Shield, that our deductible will be different than that for Region 2 and 3. Is that going to be true for this as well? We were told at a union meeting that if we are in Region 1,
It's basically, it goes back to the hospital thing, where Orlando, let me breathe. Orlando Health is in the south end of the county, so that covers that district. Region 2 has the UF region, so if they get sick and they end up at that hospital, they're covered. Us that live in Region 1, which is this region, we get sick and end up at Advent Health, where we live, it's a concern. So if we have to sign up for the Blue Cross Blue Shield, that's where the $1,000, yes, I mean, it's right there.
So here's what I can say. I can't speak at all for Blue Cross Blue Shield, number one. Number two, if you go to whatever hospital under HPI, it's going to be a $0 deductible and a $2,500 out of pocket, whatever hospital you go to. So that's not going to change whether it's hospital A, B, or C.
And does that go away once admitted?
So it's a $1,000 copay for the hospital admission, so you pay that once, but let's say 2 weeks from now you have to go back into the hospital, you're going to be paid, or have to pay another $1,000 copay till you hit that $2,500. Does that make sense? So if you go in a third time, then you'd just be paying $500, unless you'd met that $500 some other way, through prescriptions or whatever the case may be.
And again, that's renewable every year, right?
Yes,
Deductible.
yes, so it starts over at January 1st of
January.
every year. Mhm. So not that I want anybody to go in the hospital, 3 different times in a year, but yes, you could, yes. Mhm.
so, I mean, this is a board thing, I imagine. Is anywhere, do you all offer, or does the company offer this with health, high deductible plan with a health savings account, and we're just not picking that up? Or is that not something that the company does that we wouldn't possibly have as an option in the future? I'm with Blue Cross Blue Shield with the high deductible and the HSA.
That option is not going away under the Florida Blue Plan, but you're asking if HPI has a similar solution?
Uh-huh.
So we do administer high deductible health plans, but that's not what was chosen for
Right,
for
that's
this.
not what
Right.
was proposed. It is something that could happen in the future if we went in that direction.
Theoretically, yes.
Yes, yeah.
I like the way you're thinking, though. Yeah.
So if the open enrollment is in July, but 2,500 is in a year, it starts in January 1st. So that will give us just half a year to cover that. How would that work?
So, like you said, that $2,500 runs on a year. So if you, I'm just going to pick a number, let's say you met $500 so far under your current plan. That $500 would apply to that $2,500, so then you'd have $2,000 left. But, so you're not really being hurt, because whatever you've already met is applying to that
Even if
for
I
this year.
change plans?
Say that again?
Even if I change plans
Yes.
in this one?
Yep.
So what'll happen is after open enrollment, and correct me if I'm wrong with this, after open enrollment, and this, I want to be clear up front, this will not happen September 2nd. So this just does take some time for this to happen.
Yep.
So a report can be run from the Florida Blue system, and anyone who is transitioning to an HPI or to the HPI plan, they can run a report for deductible credit. So that's what they're saying. That can be put into their system, so they'll recognize if you've met $500 of your deductible under Florida Blue, they will credit you for that. So for the rest of this year, 2023, you won't lose any deductible you've met under your current health plan. They will give deductible credit for that.
You've got a this year offering and probably not future years, or?
It's only because of kind of how the plan is starting, do you know what I mean?
Yeah.
Next year, let's say we add the HSA plan, which I am not saying that at all, but let's say we do that. It would be the same sort of scenario, if you will. But this year, it's for just the one plan, and those we call them accumulators, but
Right.
the co-insurance would credit over.
Is there coverage on a pre-existing?
Yes.
Uh-huh.
So is there any deductible from September 1, that 1 year, or from January to December?
January.
Through December, yep. Go ahead. Yeah.
So, if I'm understanding this correctly, so what we're doing is if we want to stay with Advent Health, then we stay with Florida Blue. If we want to go to Orlando Health or Leesburg Hospital, that thing, then this is a better plan for us, right?
Yes, ma'am.
Is that how I'm looking at it?
Yes. Yep. You just did our whole presentation in like 30 seconds. Any other questions we can help with?
Is there information on the website about specific procedures? How much the deductible is? Like for a CAT scan, for example.
So it's not necessarily going to differ by specific procedure. It's the same copay. So if you have like any outpatient surgery you have is going to be a $500 copay. Any, you know what, we don't have imaging on here, do we? I'll have to get the information on imaging, but it's a flat copay for any of the procedures that you have done. And that will be, when we get the full details out for open enrollment, we'll make sure imaging is included in that. You'll have that information ahead of time.
And lab work, blood work.
Yes, all of that will be included in the full plan details. Yes.
Okay, so hospitals and providers like to charge beyond what we pay in our co-pays and our deductibles. So if we get billed for extra on top of our deductible from the hospital or the provider, how?
Guess what I'm going to say? Anybody guess? Call your concierge. Yeah, absolutely. And that happens with any type of plan, right? And I have a very similar plan, and I know what I'm doing, and I explain it when I go in, right, which it's just still the same person at the front desk. I get bills all the time, and I have to call and say, hey, what is this? I want you and everybody to call us anytime you get a bill if you're not entirely sure that you should have been billed, which you shouldn't have probably, right? So open your mail, call us the minute you get something. We'll look at your explanation benefits, we'll look at how the claim paid, we'll make the initial call to that provider and say, what's up, you're not supposed to do this. And then if we have to go further to fix it, we will. Sooner you call us when you get that bill, the better. Don't ignore it and assume it was somebody's mistake and they're gonna fix it. We will fix it, but call us early.
What time are y'all open?
8 to 8 Eastern.
How easy and accessible is it to talk with you? Will we get recordings or wait for you to have to call us back?
Nope, that's a great question. So from 8 to 8, you will get a person in under a minute. We like to say 30 seconds, but I'm going to be extra realistic today. In under a minute, you will get to a person, Monday through Friday, 8 to 8. On the weekends, if you have something, or after hours, we'll call you back the next day. Yeah.
Now, how does your authorizations work? Like if your doctor orders a CAT scan, an MRI, you know, right now they call you when they have check authorization and they call you and they make an appointment with you. So how does that work with this insurance? What's the difference?
It's much the same. It's just going to be my phone number on the back of the card for them to call for the authorization. But
So our doctor will still.
your doctor will still call us.
For cost, and then that company will call us and to set an appointment.
Correct. Yep. That shouldn't look a lot different. I'm going to say that we're faster at it. But I have to say that, right? Yeah. Yeah. You probably won't even know that that's happening until they call you and say we're ready to go.
Yep.
Do we have to go to a specific place for blood work?
Oh, good.
Good one.
In-network lab. So under Florida Blue, they have to use Quest.
Oh, do they?
Oh, yeah, no.
No.
But we can still use care here, right?
Care
Yes,
is not.
yes, you can still use the clinic, and
We can
if,
still get our prescriptions there for
Yep.
free and everything else. Okay.
yes, that is correct.
So that will all stay the same.
That all stays the same.
I couldn't get into the clinic when I called.
Oh, the Care Here one, or?
Yes.
Do I need to get a referral from my primary to go to a specialist? Or can I just choose my own specialist?
You can choose your own specialist.
I can choose my own specialist without referral.
Correct.
My one disclaimer to that, and that's because of where I live, is,
Well,
is my specialist required the referral. So if your specialist requires the referral, that's not the plan's requirement. That
is true. There are specialists that require.
a referral, but that's
Yeah.
not driven by the plan, that's driven by the
Yeah, I've had
specialist.
specialists ask me, oh, do you have a referral? And then they look at my insurance and go, oh, no, you don't need a referral.
Yeah,
Right.
exactly.
Right.
Yeah, so.
Right.
They'll say it on the phone.
yeah.
Yeah.
So before we make our mind up, we're going to be able to look at the physicians that
Yes.
are offered, because a few of mine are Advent, so but they're the best.
Yeah. I will tell you all, I know we're getting ready to go into the summer months, and you probably don't check your email as much during the summer months as you do during the school year, and we understand that. But there are going to be communications going out throughout the summer. I'm not saying like weekly or anything like that. You will get a couple of emails leading up to open enrollment, some more communications about the HPI plan. So do occasionally check your emails over the summer, because we are going to be sending out some more information.
And again, the Pathways team is going to be turned on in advance. So
Right.
if you, for whatever reason, cannot find your provider, please call that team because they can help in looking up before you make decisions for open enrollment.
Right.
And just to be clear, your decision that you make is for a year. So if
Right.
you, 9/1, you decide you're going to HPI, you're tied into that for 12 months, till the following 9/1. So it's not a lifetime, but it is 12 months.
Yes,
So
ma'am.
you like the new plan?
What was that?
So you like the new plan?
I love the new.
That's been the wrong
Here's what I will tell you about this plan. I I live in Pittsburgh, which is also a hard kind of city to have a plan like this, and I have an identical plan to what we're proposing to you, because I think that in a lot of ways, it's worth the little bit of effort that it takes for us to do a little work up front, or to have a concierge team to help you. The money that it's going to save you, just looking at those numbers, it's worth it for a lot of people, for me. She made, well,
Yeah.
right, and she made me elect that plan so that I could say things like this in a meeting. Yeah, go
Yes,
ahead.
ma'am.
When will we know how much it's gonna be every paycheck?
It,
Because that's an important thing.
if you have employee-only coverage, it's going to be no cost to you.
Employee only, okay. Like none?
Zero. Free. None. Yep.
And you get a cupcake.
And cupcakes and cookies.
Oh, like I have like the plan they let go.
Mm-hmm.
on Blue Cross. So like if you wanted the zero thing, it's gonna be higher, right?
It's still zero.
The-
Go back to the slide.
Yeah, can we go back to the,
You said don't look at, you look at the bottom and it's more, but you said.
no, I said, what I was saying is so it is zero for employee only, but if you look at any of the tiers that have employee spouse or employee children, or the 3559 plan, there's a cost associated with that for employee only, those are monthly rates. So what I was saying is you have to convert that to a per pay period to know what it's going to be coming out of your paycheck each pay period, but those are the correct numbers. So it is zero for employee only on the new plan. Yes.
So if I reach my $2,500 deductible, do I still pay like the $500 if I have an outpatient surgery or something? Like after that, I don't pay any more copays?
Correct. Once you hit your out-of-pocket max,
Not even for doctor's visit?
Prescriptions and stuff?
what'd you say, Rob? It's a max. It is. It is a true out-of-pocket max. So once you've hit that amount, you're covered. And then that's the same under your Florida Blue plans as well. Once you hit your out-of-pocket max, you're covered at 100% for the rest of the year.
Did you find out where we can get our blood work?
Oh, Quest and LabCorp are in network with EHN, and you're, yeah.
Yeah.
So the Florida Blue plan has some coverage, if you want to call it that, for vision and for health, physical fitness, actually. Does this plan have anything like that?
I don't know that there's any vision built in.
We did not do vision.
No.
What about a cheap rate at the gym?
No, those are, unfortunately, no. No, those are built in kind of as extras on the Florida Blue plans as a whole. So no, those wouldn't be
So like
included.
cataract surgery and stuff like that.
That's different. That falls under medical,
That's because there are two types.
right? It's,
I use my medical side to go see and then the vision, which is just.
correct. Yeah, so it's not going to cover like a vision test,
Yeah.
but it will cover glaucoma or cataracts. If it's a medical diagnosis, it would be covered.
There's a
There's a
A lot of
difference.
people don't know the difference.
Yep, you're right.
It's not gonna cover hearing aids.
Nope.
How about the dentist?
I had to try.
dentistry?
No, so you'll still have your dental and vision plans separate, so those aren't covered under your current medical plan either.
Like we do now.
Right, correct.
When we get more information about it later, will we be able to get more detailed things about like how much physical therapy is covered and things like that?
Yes,
Okay, so later.
yes.
It'll still be about 20 sessions and that kind of thing.
Probably be similar.
I
I would think that would stay similar.
yeah, I think it's probably going to be, so I don't know 100% the number, but it's going to be very similar to current.
So just to reiterate, we're offering you a dedicated concierge team, quality care, right? So you're not going to poor rating providers or facilities. And then we're offering it to you at a reduced cost, of course, so richer benefits. I feel like it's a win-win, but I'm also in sales, so. More information will be coming out. Your Pathways Concierge team will be turned on for you to ask additional questions prior to open enrollment as well.
I live in Lake County, I live in Howey, so you're not gonna send me to Orlando to see a doctor, are you?
You can see any contracted facility that's included in the EHN network. The same with the providers. So the providers should be within the EHN or PHCS network. If you choose to seek care at a facility that is not contracted, that's where you need to call the Pathways Concierge team so we can help educate to make sure this is the right plan for you.
Because this area is mostly generated around Advent Health.
Mm-hmm.
So like, I go to Orlando Health, so this excites me, because my doctor's all the way in a port.
Mm-hmm.
So, but every doctor, I'm trying to move this way because of Advent Health, so now I can.
We'll help you through it. Yes.
Does
Yes.
this insurance cover chiropractors or?
Julie?
Let me ask you,
Wait.
that's not, oh, go ahead.
No, go ahead.
I was going to say, does Blue Cross Blue Shield cover those?
It covers chiropractic.
Okay. Because the intent, and correct,
It's
is
just
to
mirror,
mirror those,
yeah.
what's covered under Blue Cross Blue Shield. It's to mirror that very closely.
I don't know, I don't have confirmation on what a copayment would be for that yet. It's probably going to fall under specialist. I would assume, we'll get that confirmed, but it will be covered. All right.
All right, if there's no other questions, I wanted to speak to whoever asked the question about, is this a good plan? I'm not biased, unlike the people behind me. So I'm not in Florida Blue at all. I'm 100% disabled VA. I've been using the VA since I got out of the Army. One of the few people that actually had a good experience, so I just stuck with it. And I've avoided other health plans to avoid screwing up my stuff at the VA. This is exciting enough that I'm willing to mess that up to do something better that's closer to home and actually pay money. If I had zero copays, I had zero anything. I'm willing to pay $20, $40 to be able to go and pick my care and be a lot more involved in my health care. So there's a little plug for you. Say again? Parking's nice too. So there you go. That's my little plug. If this is the right plan for you, it's going to be great. I'm excited for it. So, all right.
Thank you for your service.
You're welcome.
Thank you.
Guys, if we talk about the other, the 80%, physicians more, that would alleviate the concerns from a lot of people. Because now we're going to expose them to a lot of the physicians that they possibly are seeing within that network, the
PHCS, yep, that's right, yeah.
Can you talk a little bit more about that? I think you can say a little bit more.
So this is the part where we have to punt until July 1st. So the PHCS, again, it's just physician and ancillary only, but it is a broader coverage for providers. So EHN is your primary network. Outside of that is the PHCS, and then if you do seek care outside of an EHN contracted facility, that's where, of course, we're able to help or advocate during that time, but that's where your Pathways Concierge team comes into play. Outside of that, like the PHCS network is the broadest physician and ancillary network that there is. So it's, whenever we talk about the 80% there, a match to Blues, it means that about 20% of the providers were not in the PHCS network. So the majority of your providers should be covered between EHN and PHCS. Mm-hmm.
We automatically get both. It's not like an HMO, PPO type of thing.
You automatically get both. That's correct. We want to steer to EHN because that's where your quality, like we know hands down, that's your quality providers. Those are the best-in-class providers. Those are the providers that have to meet certain performance metrics in order to be included in that EHN network. But you will always have access to both EHN and PHCS. Mm-hmm.
When the recorded version of this becomes available, can those slides with those prices be included in that so we can see that up close?
Yep.
Yes.
Right.
Thank you.
Thank you.
Thank you. Don't forget donuts and cookies up front.
Cupcakes, take 'em.
12 people.